We've got a great show coming up for you on American Black Journal. Michigan's chief medical executive, Dr. Joneigh Khaldun, is here to talk about COVID cases, the impending vaccines, and when we could see a sense of normalcy return to our lives. Plus, I'll talk with NBA legend and former Detroit Mayor Dave Bing about his new autobiography. Stay right there. American Black Journal starts now.
From Delta Faucets to Behr Paint, MASCO Corporation is proud to deliver products that enhance the way consumers all over the world experience and enjoy their living spaces. MASCO, serving Michigan communities since 1929.
Support also provided by the Cynthia and Etzel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by NISSAN Foundation. Ally. UAW. Solidarity Forever. Impact at Home. And viewers like you. Thank you.
Welcome to American Black Journal. I'm Stephen Henderson. The number of coronavirus cases across the country continues to just soar. More than 15 million Americans have now been infected. Here in Michigan, restrictions on various businesses have been extended in an effort to slow the infection rate. And for the first time in more than 100 years, the big football rivalry between the University of Michigan and Ohio State University has been canceled because of the number of players who've been infected. I had a candid conversation with the state's chief medical executive, Dr. Joneigh Khaldun, about the COVID-19 spread and the impending vaccines. I think there's a lot of confusion about why certain businesses remain closed while others remain open, and why, given the tremendous effort that was made by so many businesses when we did have the economy open to be safe, that we still ended up having to go back to at least a partial closure. Walk us through how you are making that determination.
Absolutely. So I can tell you this has been a very tough year for everyone. And it's because of the virus. The public health threats are very related to the economic threats, there's no question. And the better we can get this virus under control, the more we'll all be able to get back to some sense of normalcy, if you will. So I can tell you the way we think about it, and from the public health perspective, it's all about levels of risk. And looking at the numbers and the data at the same time. So as you all are aware, we had an incredible, just terrible surge of cases in the spring. We were one of the hardest hit states in the entire country. Of course, it was concentrated in the southeastern part of the state. We were able to bring that curve down, and we did it really primarily by people doing the right thing. We did have to limit some businesses being open, but again, that's all based on risk. So when you think about it from a public health perspective, there are some things that are just riskier than others, and things that are associated with outbreaks, whether it's in the state of Michigan or based on the data that we're seeing across the country. So being indoors, not having on masks, having poor circulation, gathering in groups. Pretty much if you add those things all into an equation, that makes some things more risky than others. And as we've seen this terrible, awful surge this fall that we all really dreaded, and we're in the middle of it right now, when we started seeing these cases increase exponentially, even more so than where we were in the spring, we had to start making really tough decisions about how we decrease risk. And that is how we're making decisions about how we determine which businesses are able to operate fully at this time.
So a lot of criticism that I see about this is that it's arbitrary. Restaurants are closed, but gyms aren't. One kind of business gets gets closed, another doesn't. How do you answer?
I don't think it's arbitrary. Again, it's based on risk. So there's plenty of data. There's all kinds of studies that are national experts, international experts, quite frankly, the CDC. There's no question, the data is quite clear that indoor restaurant dining is associated with outbreaks, again, across the entire world. So that data is actually quite clear. And that is why under the current order, unfortunately, we had to limit indoor dining because that is the riskiest thing. And again, gyms are actually open right now. It's just those groups with the fitness classes. Again, you'll see these themes of public health and groups and people not wearing masks and being indoors. Those are the types of things that differ by business, just based on the type of activity that occurs in that particular business.
Yeah. Let's talk about what's coming in the next few months. We are starting to see at least initial rollouts of the vaccination in Britain and soon here in the United States. How much is that going to change for us in Michigan, and how soon are we going to see those changes? I think there's a lot of anticipation about what a vaccination actually means. None of us, though, really knows how quickly that we can get back to the world.
Yeah, I'll tell you, vaccines are a game changer. I am very hopeful, pretty confident that 2021 will look very different than 2020. And so hopefully, right now there are two vaccines, one made by Pfizer, the other by Moderna, and they're both already at the FDA. They've applied to be approved to be used throughout the country. We still don't know when they'll be approved. We hope that Pfizer will be approved even as early as December 15th. Moderna, if all goes well, will be about a week or so after that. We still don't know how much vaccine will be allocated to the state of Michigan, but I can say it will be in very limited quantities in the very beginning. So what we're going to see is that, again, maybe as early as next week, we will start seeing a slow rollout of vaccines in Michigan. We'll have to focus on high priority populations, which are healthcare workers, essential workers, people who have underlying health conditions, the elderly. Those populations initially will be targeted to receive the vaccine, and then hopefully by late spring, it will be available to the general population. My hope is that by late 2021, the vast majority of adults in the state of Michigan will receive the vaccine, and we'll really, at that point, start seeing things go back to normal. In the meantime, it's still going to be about wearing your mask, washing your hands, and maintaining your distance. We've got to keep these case numbers down at the same time as we roll out these vaccines so we can really get a handle on this pandemic as quickly as possible.
I want to talk to you about a recent poll that I saw of Detroiters, which was really depressing. It suggested that a majority of Detroiters are skeptical of the vaccine and may not want to take it. Now, of course, we all know that there are very spectacular historical examples that drive that kind of suspicion in our community. What would you say, though, as the state's chief public health officer to African Americans and other people in Detroit about why we should trust, why we should go ahead and take this vaccine?
Well, let me just acknowledge again, as a Black woman, I completely understand why African Americans and other minorities may be skeptical of the healthcare system. And I certainly recognize that racism does exist in the healthcare system. So there's no question about that. But I also think it's important that we look at the process and we understand the data and the facts, and that we use that to inform our decisions on what we want to do. I can tell you that even though it appears that the vaccine approval process is fast, it actually, no steps have been skipped at all in the vaccine approval process. So all of that data, all the facts about these trials, again, tens of thousands of people have been involved in these trials for this vaccine. It will not be approved. And quite frankly, I will not allow it to be distributed throughout the state of Michigan unless there is data that shows that it is safe and effective. So I think it's really important that people understand the data. I'll also say people should know what to expect for the Pfizer and the Moderna vaccine, the two who are the kind of front runners right now. You'll need 2 shots. So you'll need to get one initially, and then you'll need to come back in either 3 or 4 weeks, depending on the vaccine, to get another one. It's also important that you know how vaccines work. For example, you might get some mild side effects from the vaccine. You might feel a mild fever. You might feel a little malaise. That's actually a good thing. The vaccine does not introduce the virus to your body. What it does is prime your body so that it can make a response, so that if it comes in contact with the real virus, it can fight it off. So it's important to start learning about the process, learning about what to expect, and then hopefully making a good decision, which I hope, again, will be to get this vaccine. This virus has devastated minority communities across the entire country. And this is the one tool that we have that will help bring that curve down and eliminate that disparity. So it's really important that we take a strong look at getting this vaccine. And I would say, especially for minority communities, we don't want to expand that disparity any more than it already exists.
And sort of a companion question and issue is, so how quickly then do we see a return and a relaxing of the restrictions that we're living with now, the public health restrictions, to try to control the virus, if we can get vaccines, going early in the year, maybe by spring? Does that give you some idea of the timetable we're working with?
So that's right. I'll tell you, if we want to get back to normalcy, I tell you, if everyone just wore their mask every time they're around someone outside of their household, if everyone washed their hands, if no one gathered and everyone decided to get this vaccine when it becomes available to them, I'll tell you, by next fall, we'll be okay. Life will look a lot normal. Most businesses, if not all, again, I'm predicting here, but most businesses, if not all, will probably be able to be open by next fall. But all of that depends on our behaviors and the choices that we make. I think it's important that everyone understands they have a role to play in ending this pandemic. If we want our businesses open, our restaurants, our sports, our schools, if we want to potentially stop wearing masks everywhere, we all can do something about that right now to get our cases down. But we have to be mindful. This is overwhelming our healthcare systems, or getting close to it. If you go to a hospital and there's so many COVID cases that you don't have a bed for you or a loved one, it's very concerning. So I think it's important we all kind of understand the role that we individually have to play in getting back to the sense of normalcy in society.
Okay, Dr. Joneigh Khaldun, it was great to have you here. And of course, we hope for better times soon. So thank you for being with us.
Thank you for having me. Stay safe.
We turn now to a new autobiography by NBA legend and former Detroit Mayor Dave Bing. In Attacking the Rim, Bing chronicles his journey from pro basketball to the business world to getting elected as mayor, and now as a really important mentor for African-American youth in our city. I spoke with him about the book and his multifaceted life and career. I'm going to be a bit of a fan here. Talk about the impact you had on the game of professional basketball. It was a different game when you left than it was when you started, and a lot of that had to do with the way you played it.
Well, I only knew how to play one way, and that was giving 100% and never taking a day off, whether it was through practice, whether it was exhibition games, whether it was, a regular NBA game. And I learned to play, on the playgrounds of Washington, D.C. So a lot of things that I learned as a young basketball player came from guys that I grew up with. Most guys were a little older than me, and kind of took me under their wing to tell me, the nuances of the game of basketball. And the game that I brought to Detroit and the NBA is quite different from the way guys play today. I think guys today are more gifted athletically. Most of the guys today start playing basketball at a very young age, and it's the only sport that they play. In my era, we played multiple sports. So I was a better baseball player early on than I was basketball. But because of the eye injury that I had in my left eye as a 5-year-old kid, I really couldn't really see out of that left eye. And so as I moved up into the high school ranks, the pitchers were much better than they were as a youngster growing up. So I really couldn't see the baseball coming out of the pitcher's hand in high school. And so I knew I had to make a change, and I chose to play basketball as opposed to baseball.
Yeah. And the position you played, point guard, you really revolutionized in terms of the way you approached it, and really paved the way for the point guards that people in my generation would remember, Isaiah Thomas and people like that. You create the position that they end up playing.
Back in my era, we were just guards, and I was a dominant guard because I had the ball in my hand a lot. But Oscar and Jerry, nobody would say that they were point guards, but I guess we all were. And we could score, and we could also pass the ball and create easy opportunities for our teammates. Today, the game is quite different. Point guards are basically the guys that are setting everybody up, and you don't have a lot of point guards today that also score the basket. Yeah. But as I looked at the transformation of the game, and I saw when Isaiah came in, he was quite different also. He was an extreme point guard where he could get everybody involved, but when necessary, he could also take the ball and be a scorer. You don't see too many guys doing that today as a guard.
Yeah. Of course, you leave basketball and go to the business world and later to the political world. How much of what you learn in sports applied in business or in politics?
Well, I think a lot of it applied because you could be blessed by God with all kind of athletic ability as an individual player. But the key to winning was making sure you made everybody else around you a better player. They had to get involved. And so I did that early on. And as I got to the middle part of my career, I had been the high scorer for 5-6 years in a row with the Pistons until Bob Lanier came along. And a lot of people didn't think we would get along because all of a sudden you give up your stardom and you got to share it with somebody else. But basketball is a team sport. And, I was happy to have Bob come along because I saw the talent that he had and I saw the need that we had. And I think we formed a great duo for the time that we played together. But you got to get along with people. You got to understand what your strengths and your weaknesses are. You got to understand the strengths of your teammates and their weaknesses. And I think as you go from sports and you go into the business arena, the same thing is true. You're not going to know everything, nor can you do everything. So the key is to identify talented people to surround yourself with and allow them to grow and express the talents that they have. And I think the same thing is true in politics. You may be the leader and name and responsibility, but you got to have good people with you, because as I moved into the arena of politics, it was altogether different from sports, because you had people with different agendas in the area of politics. In basketball and in sports, we had the same dream, and that was to win. And we did whatever was necessary to try to put ourselves in a position to win. Politics brought a whole lot of different agendas to the table, and you come in, and the nuances are, all of a sudden I got 14,000 people that I had to deal with. Basketball, I had 12 people. Business, it started with 4 and it grew, but trying to run a city with 14,000 people as employees and be able to satisfy the people who lived in the city, the businesses that were in the city, was quite different. But it all really revolves around people. You got to have good relationships with the right people, letting them know what's important to you from a cultural standpoint, from a work ethic standpoint. And it took some time for me to get that ingrained in the people that I inherited. Mm-hmm. But by the time I left, people understood what it was that I wanted to achieve, and we all worked as a team.
The work you're doing now with the Bing Institute, with young men in the city, I think is signature work. I mean, it really is the kind of thing that, as you say, brings you back full circle, but also forges ahead in a way that's really important in the mentorship space. Talk just a little about how different the Bing Institute is than other mentoring programs, and how much it means to you and your legacy.
A lot of these kids are told forever what they can't do, what they can't achieve. And we've got to get them into a different mindset. Because you're Black, because you're a young male, because you're in a public school system, because you come from a broken family, are a lot of reasons to accept failure. But our goal is to make sure that with all of these negatives that you grow up with, if you do the right thing, if you make sure that you understand how important education is, if you make sure that they understand how important family is and community and the city that you represent, you can take all of those negatives and turn them into a positive. And so one-on-one mentoring was what we thought was the most important thing, because a lot of these young men, or all of them, they really don't have a dad in their life. They're groomed by their mothers or their grandmothers or their aunts or their sisters or whatever. And especially when they become teenagers, it's very, very important that they have successful men in their lives, people who care about them, people who can advise them. And so that's really what we focus on. And I will tell you, it makes a major difference in the lives of these young men to have another man in their life. When I was in high school, all the way through school, there were men who were my mentors. I mean, I had science teachers, I had math teachers, I had history teachers, I had social studies teachers. There were doctors, there were lawyers, there were people in my neighborhood that were all men that I could look up to as my role model. But I was fortunate to come from a family where I had my dad in my life. And so I look at these young guys today, and if they don't have a man in their life at some point in time, it makes a significant difference. So the mentors that we have are guys that came from the same kind of environment that our kids, our boys come from. And we ask them not to try to be a surrogate dad. We ask them to be a friend. The mentoring goes beyond, we're not educators. So if you can be a friend and you can be there to listen and to give advice, we're not trying to make those kids us. But we let them know that we come from the same kind of background that they come from. We've had some success, and we want to share that with them and let them know that they too can be successful.
That is going to do it for us this week. As always, you can find more information about our guests at AmericanBlackJournal.org, and you can connect with us on Facebook and on Twitter. Stay safe, and we'll see you next time.